Okay, next we have call to the public. We have two individuals, both speaking on veterans issues, Veterans Committee, and we'll start with Les Schneider first.
I'll try to make it real quick and not too in-depth, just because, you know, most of you already know what I'm going to say before I do. Two things one, I'm working on a project, as a couple of you already know, about working in conjunction with Habitat for Humanity, supplying small, tiny homes on wheels, or just tiny homes, and is to be paid for by grants through the Habitat people. I mentioned the property beside the juvenile detention center, or used to be, out there in the field. It's a county property. Somebody was supposed to be checking on. Some people just don't need to be named. But anyway, I left a message up to Pete Preston's office to make sure that zoning and all the codes and all that are not going to be a problem. He hasn't gotten back to me. I've also talked to a couple of other organizations, including a lot of the veterans organizations, to supply manpower is to put these trailers together. I went a month ago down to Florida for a training seminar to show us how to build these little homes on wheels. Took us 3 days, and we built actually one that wasn't on wheels. It was 12 by 30, top to bottom, complete. It was later given to a disabled veteran, and the property that it was going on was donated by the state of Florida. So he got a home for now. There's a lot of things on the internet showing his tiny homes, and it's a big craze right now. All over the U.S. There's one on YouTube right now. I think it's YouTube or Facebook. Is about a village for veterans in Kansas City. They put 50 houses together just for veterans that are having problems. It's temporary housing for emergencies. If the Habitat for Humanity can get the grants, to pay for everything, it's a good deal. We want to make sure that you guys are aware of it, and if somebody will get off his rope and find out about the property. And then same with the codes and zoning and all that other stuff. They want to, Habitat wants to use them for emergency situations, not just for veterans, but for people that have, per se, maybe an emergency, their house catches on fire. They got to move out. Now they get their houses sitting there half demolished and water damaged and all that, and they're staying who knows where. Put one of these trailers right in their drive, and now they are on their property watching their own stuff and being able to clean out and doing all that. And it's not hurting them any more than what little they're going to get back from insurance to pay for the damage of the house. They'll all be, disabled dimensions and stuff, so you can get through them with, the older folks can get through them with wheelchairs and things like that, compliant, so that anybody can use them one level. And it's just an all-around good deal, and it's not only going to help the veterans, but it's going to help people that are having emergencies. And as long as we can get grants, it's a heck of a good deal. And it's actually taking care of people that we all know, and half the time we're related to. It is a small community. The other thing that I was going to talk about is our VA office, our VA committee. There's a lot of problems with that, and I've talked to some of you, and I can talk to, the rest of you. There's things that are wrong up there that needs to be fixed. And the last bunch of commissioners, the majority basically didn't want to address it. And I'm trying not to go on, but there's a lot of veterans that need help, and they're not receiving it. And we're slowly turning things around. Okay? Other than that, I flapped my jaws enough.
Can you tell us this Village for Veterans, so I can look it up online? Is that Kansas City, Kansas, Kansas City, Missouri?
Kansas City, Missouri.
Missouri, okay.
But there's a lot of things. You just type in tiny homes or tiny homes on wheels, anything like that.
Okay.
There's a lot of things on TV.
I've seen the show, yeah. Oh, okay, thank you.
And they'll beat you to death with knowledge.
Thank you. Matthew Shepherd.
Larry was just telling me he doesn't have a camera on him, and he needs one.
He found out where to sit.
Yeah.
My presentation has to deal with the Veterans Committee as well. We've been operating a Veterans Committee that's been operating out of the rule of law, constitutionally and whatever else. Why it is, I don't know. Do they have some power grab over the commissioners? I don't know that. And then we have a county attorney that gives two different varying decisions on what PA 214 could have been used for, and nothing's been done about that. Kind of relates to the code that I spoke of yesterday with Title 42. If you knowingly allow it to happen, then you're just as responsible as they are. And to continue on is going to be a detriment to the people. Veterans, especially in this case, are going to continue to suffer. Because the millage that was passed back in 2014 for the veterans, they went all around, the Veterans Committee, telling all these veterans organizations that it was going to go to help the veterans. Not the case. It's going to help the salaries of those in the offices up there as well as the Veterans Committee. I'm a 23-year veteran myself, so I'm not out there plugging against the veterans, I'm plugging for the veterans. I certainly hope you guys will do something.
Can you give us some other examples, or could you get us something in writing about when you say they're operating outside the rule of law? Can you want to tell us now, or do you want to put together a list?
Been given
to
commissioners. You not have one.
Like, when was this package given to us?
Did you get one from them as well? Or?
No, I haven't, but I can,
We'll do it tomorrow at lunch.
It'll be on my agenda tomorrow.
Okay, well said then.
I've got a lot.
Okay. Okay, thank you. Next, we'll move to item number 4. Consider authorizing the health department to hire an intern for personnel, community health at a pay rate of $12 an hour with no fringe benefits, and authorize Larry Johnson, health director, to sign all necessary documents. Do I have a motion?
I'll make the motion. Support.
Okay, discussion. Larry, would you like to?
Thanks a lot. We got a grant in the health department for maternal child health. Sorry, losing my voice here. Specifically focusing on maternal depression. Sheriff has a couple of individuals over in his jail right now. Bad problems with these two gals. One of the babies died, and one was severely beaten. We got a problem with that, a bigger problem, community-wide, and we're gonna hire an intern to work on a special project specifically focused on that. Typically in the summertime, I hire interns, usually in environmental health, but this grant came up and it came at kind of an opportune time with what was going on in our community. You know, a lot of it's related to drug addiction, and it's another focus that we have. But you know, when we can get an opportunity like this, we'll go after it. So I wish it weren't the case with some of these things that we're seeing in the news, but unfortunately it is. So I'll take any questions.
This grant supported?
Yeah, it's from Michigan Department of Health and Human Services. It's in addition to our usual funding that we get from the state. Specifically, our new personal health director is really good about going after, as you know, important health and some of these opportunities. She's a go-getter, and we're gonna go after some of this stuff, try to address some of these problems in the community. And, you know, we partner with the sheriff and, you know, the drug court, Judge Stewart. It's all interconnected. We work with this gentleman too, in the prosecutor's office, so it's a team effort. The county does have a lot of involvement in this, so.
So this is an intern based on a grant, but it's possible that it could turn into something more than that?
Well, it depends. The grant is limited, and usually I hire the interns, you know, on the summer range. We like to get college kids on a public health track. So you're looking at, you know, May 1st to September 1, thereabouts. A lot of times we get masters of public health students that are working on a project that directly would relate to, you know, what we're doing in the health department. And, you know, it could lead to something down the road. So I'm always hopeful. Any other questions? Okay.
Any other discussion? Okay. All in favor, say aye. Aye. Opposed? Motion carries. Next item, considering appointing Charles W. Dodge to the Shiawassee County Community Health Mental Health Authority Board for the period of March 16th, 2017 to March 31st, 2020, or until a successor is appointed, and authorize the board chair to execute all necessary documents.
Make the motion.
Make a motion?
Support.
Okay, discussion.
Yes, these are just our nominations, our paperwork that came through. We did have 2 individuals that applied for an opening a couple of months back, and then we had, just this month, 3 that expired. Sent out letters to the 3 that expired, only received 2 back, so that's why we're going ahead and appointing the other member that applied previously, since he was already interested, so that's what we got. All these will have to do with the same thing, the next 4.
Okay. I know Charles Dodge, or Bill Dodge personally, lives out in Langsburg. Worked with him in the past on stuff. Wonderful background. He's a current elected official, past elected official, licensed professional counselor, certified advanced alcohol and drug counselor, national certified counselor. There's a 2-page resume here that lists a ton of stuff. Resumes, Larry Sparks Jr., over from the Langsburg Fire Department, and East Nissy Police Department is listed as a reference. Take that reference very highly, so I think this will be a good addition to the board. So, any other discussion on Mr. Dodge? Okay, do I have a motion?
We already have one.
We do. Oh, that's, I'm sorry, we're on discussion. Okay, so all in favor say aye.
Aye.
Opposed? Motion passes. Next one, consider appointing John Horvat to the Shiawassee County Community Mental Health Authority Board effective March 16th, 2017 to March 31st, 2020, or until a successor is appointed, and then authorize the board chair to execute all necessary documents. Do I have a motion?
I'll make the motion. And support.
Support. Okay, discussion. We have a letter from Mr. Horvath. Many of you know he's a former county commissioner, currently serving on the Wausau Zoning Board of Appeals, chairman of the Brownfield Authority of Owasso, serves on a couple other committees.
He was on this committee during his
Yep.
10 years as a commissioner as well, so.
Correct.
Is he on the ZBA?
No.
My memberships included, he was Central Dispatch Board, Community Corrections Advisory Board, Health Board, Mental Health Authority Board, Planning Commission, Midwest Michigan Trail Authority, and Shiawassee County on Aging.
Oh, he was applying for this one.
So, any other discussion on Mr. Horvath? Okay, all in favor say aye.
Aye.
Aye, opposed? Okay, motion carries. Next, item 7, consider reappointing Jeannie Ladd to the Shiawassee County Community Mental Health Authority Board for a period of March 16, 2017 to March 31st, 2020, or until a successor is appointed, and authorize the board chair to execute all necessary documents. We have a letter from her.
I'll make that motion.
Support?
Okay, discussion? Okay, we just have a letter from her talking about she served on the board and would like to continue. So, any other discussion? Okay, do I have, all in favor say aye. Aye. Opposed? Okay, motion passed. Number 8, consider reappointing Janelle Hughes to Shiawassee County Community Mental Health Authority Board for the period of March 16, 2017 to March 31st, 2020, until a successor is appointed, and authorize the board chair to execute all necessary documents. Do we have a motion?
Motion.
Support?
All right, okay, discussion? We just have a short little letter from her asking for her renewal to the board. Any other discussion on Ms. Hughes? Okay, with that, all in favor say aye. Aye. Opposed? Okay, motion passed. Number 9, other agenda items. Do you want to have anything else?
I think we have anything at this time.
Okay, call to the public. Okay, with that, meeting adjourned. 16 minutes.